Hello, and welcome to Let's Rap About Health Gaps. This brief 20-minute webinar will focus on data and tools to understand the size and nature of health gaps and to help continue a conversation about how to close them. The health gaps reports and an accompanying discussion guide will be featured. We'll show you where to find these and other Action Center tools to aid in framing and messaging, and we'll share an example of a community that is making great use of dialogue to address equity issues. We'll also have some time for Q&A. I'm Marjorie Gibbons, and I'm joined by my colleague, Jan O'Neill. Jan will be fielding your questions and comments throughout this brief webinar.
Hi there, and please do send us your questions along the way. This is going to be a short webinar, just a short amount of time here, so make sure you get your questions in. Thanks.
Sorry about that. We've got it all squared away now. So just to begin, just wanted to acknowledge that the County Health Rankings and Roadmaps program is based at the University of Wisconsin Population Health Institute and is a collaboration with the Robert Wood Johnson Foundation. We'd like to acknowledge that this program is the result of the contributions of many, many colleagues and partners, both here in Wisconsin and across the nation. Thanks to their support, we're able to bring you this webinar today. Before we dive in, a quick orientation to the technology that we're using today. The GoToWebinar attendee interface is made up of two parts. On the left, you can see the viewer window, where you will see our screen throughout the presentation. On the right, you can see the control panel. Here, you'll find handouts for today's session, including a PDF of our slides and a PDF of the worksheets that communities use to prioritize. You can also interact with us through the control panel by using the questions section. Please feel free to ask questions or share your thoughts and experiences with us via the control panel throughout this webinar. We'll be sure to leave time for your questions. This is our essential question today. How can we use data to highlight inequities and mobilize action to address them? Our roadmap for this brief 20 minutes is to share some context and grounding on what we mean when we talk about health gaps, talk a bit about the health gaps reports and discussion guide, and where to find them on our site. We will also illustrate how communities are putting these concepts in motion, and then open it up for question and answer. So let's begin with some context about the differences in opportunities and health outcomes that are present across our nation's counties. What if everyone had the opportunities of residents in the top performing counties in each state? What if all residents had a fair chance to be healthy? In Wisconsin, this could mean that 1 in 6 premature deaths could have been avoided. In Pennsylvania, there could be 394,000 fewer adult smokers. In Colorado, there could be 160,000 fewer obese adults. In Georgia, there could be 284,000 fewer adults who drink excessively. If all residents had a fair chance to enjoy good health, in other words, health equity, what does this mean? Health equity includes a shared commitment to identifying and addressing health gaps, and an opportunity to attend to those that disproportionately or negatively affect certain populations. Health equity is a basic principle that all people, despite race or ethnicity, limited English skills, gender, age, religion, income, education level, geographic location, sexual orientation, or ability, have equal opportunity to lead healthy lives. It also means creating a sense of community where all individuals, especially those most affected by poor health outcomes, feel they have a voice and a role to play in creating and implementing solutions. Healthy People 2020 calls for valuing everyone equally, addressing avoidable inequalities, and eliminating health and healthcare disparities. So with this context in mind, we wanted to better understand the size and nature of health gaps among counties within states. Since 2010, County Health Rankings has provided a snapshot of the health of nearly every county in the U.S. We have ranked neighboring counties within each state on the factors that are important to health, such as health behaviors, clinical care, social and economic factors, and the physical environment. With the County Health Rankings Health Gaps reports, we dove further into how different a county ranked number 1 is from number 2, and further explored the nature of health gaps. As I just mentioned, health gaps can exist in many dimensions. These reports focus on differences based on geography, or where you live. To develop the reports, we asked How big are the opportunities for health improvement within states? And how could states work to make sure that everyone has a fair chance to be the healthiest they can be? Each report details how well the healthiest counties in each state do, what would happen if residents of all counties had the opportunities for good health, and strategies to help close the gaps between the healthiest and unhealthiest places. We know that many state policymakers and leaders are already taking important steps to shape our communities so that everyone can live long and well. And with these reports, we intended to provide information to support these efforts. So what do we mean when we talk about health gaps? And what do we know about how they come about? Gaps in length and quality of life are differences among residents from one county to the next in how long and how well they live. Some counties lag far behind others in the opportunities to be healthy, such as access to safe housing, good schools, and a job that pays a living wage, nearby recreational facilities, or grocery stores with fresh and healthy food. Gaps in the factors that influence health occur when people are denied opportunities available to others. These gaps don't come about on their own. Rather, they are the result of systems and policies that are put in place by decision makers before us that have remained largely unchanged in the face of growing needs. Gaps in health outcomes are costly and preventable. Knowing that yesterday's decisions are a source of our current challenges also uncovers the possibility that the decisions that we make today can help build a culture of health for everyone, everywhere. By taking action to create more equitable opportunities, these gaps can be closed. When we think about closing health gaps, it's not just about offering everyone the same opportunities to be healthy, but rather the resources necessary to realize the same health outcomes. This image of the three children can illustrate the point. Consider these three children of different heights. Offering them all the same size bench to stand on would mean that the shorter children will not have a fair chance to see over the fence. Offering each child a bench to stand on that is the right size for his or her height gives all children a fair chance to see over the fence. Each of these components in this graphic can mean different things in different communities, and their meaning can change over time. So take a minute to consider this image and its meaning for your community. As the County Health Rankings model shows, we know that a range of factors are important for good health, but there are meaningful differences in the opportunity for good health according to where people live, learn, work, and play. This map shows that within each state, there are communities that lack opportunities to shape good health, such as differences in child poverty rates. Health gaps like these are avoidable and limit the opportunities for all children to be as healthy as they can be. In this map, the size of the circle displays the size of the gap in child poverty rates within the state. For example, a bigger circle means a bigger gap. The gap represents the difference in the best and worst performing counties in child poverty rates within the state. The color distribution shows how overall state child poverty rates vary nationwide. The best performing states are in orange, while the worst performing states are in purple. So from this map, for example, you can see that in Maryland, child poverty rates are relatively low compared to other states. The overall state value for child poverty in Maryland was 14% based on data from 2013. But you can also see that there's a notable gap between the best and worst performing Maryland counties for child poverty. For example, the best performing counties had a child poverty rate of 9%, while the worst performing had a child poverty rate of 29%. On the other hand, West Virginia has a high child poverty rate compared to other states, with a value of 26%. And there is a very small difference between the best performing counties at 23% and worst performing counties at 35% in child poverty. The health gaps reports were developed for each of the 50 states and provides further information on the meaningful differences among counties and the factors that influence health. And you can see from this table for Wisconsin, for example, that we provide descriptive data for the best performing and worst performing counties in the state mean, and the best performing U.S. counties for each measure. Factors with meaningful differences are called out with arrows in the table. And if we look more closely at the factors, we can see that, for example, there are meaningful differences in Wisconsin in adult smoking, obesity, unemployment, children in poverty, and severe housing problems. And having identified factors with meaningful gaps, we then draw evidence-informed strategies from what works for health to offer approaches that community leaders, state policymakers, and their communities can take to improve health of all residents statewide. For example, policy systems and environmental change, such as implementing smoke-free policies, enhancing early childhood education through universal pre-K or incentivizing affordable housing development with low-income housing tax credits are proven approaches to improving opportunities for healthy choices that can reduce healthcare costs even. These strategies are among many resources that you can find at What Works for Health, a database with over 360 policies and programs. What Works for Health is a great place to start. One of the drivers in generating the Health Gaps reports was to help support dialogue about the differences in the opportunity to be healthy and steps that can be taken to close health gaps. In order to help continue these conversations, we created a Health Gaps discussion guide. This guide is a tool that offers tips and resources for outreach to diverse stakeholders, how to convene discussions on health gaps, and how to create safe spaces for people to tell their truth. To learn more about these resources, you can visit our website. The Health Gaps reports can be found here under the Resources tab. The Action Center has many resources, including the Health Gaps discussion guide that can be found by navigating to Work Together here in the Take Action cycle, and then also within the key activity area, Work Together to Address Health Inequities. And within that activity area, the Health Gaps discussion guide can be found in the suggested tools here. You will also find these orange boxes located throughout the Action Center inviting you to contact us for personalized free help. This is the best way to connect with one of our community coaches. Please don't hesitate to contact our coaches if you need any assistance with a tool, with a question, or figuring out the next steps in your process. Thanks to the support of the Robert Wood Johnson Foundation, we have 11 community coaches based in Madison, Wisconsin, and regionally throughout the country. Our assistance is available to you at no cost, so don't hesitate to reach out. Many communities across the nation are taking steps to advance health equity. I wanted to briefly share with you one community where residents are putting these concepts in motion, Everett, Massachusetts, a 2015 Robert Wood Johnson Foundation Culture of Health Prize-winning community. Everett community members are addressing potential issues of racial justice, immigration, and assimilation by bringing people together from across the city to talk openly and safely about how cultural and racial inequities affect residents' well-being. They are taking steps together to ensure all people have an equal opportunity for good health. You can check out our other webinars on Everett's community engagement and organizing efforts on our website. And we invite you to visit the Culture of Health Prize website to learn about how other communities are coming together to understand and address health inequities. I'll close with a few reflection questions that we raise in the Health Gaps discussion guide. First, how can you develop sustainable solutions and track your progress in addressing health gaps? How can you bring diverse people together in a safe space to talk about gaps and how to close them? What strategies are helping to close gaps in your community? Are there stories of success that can be shared? How can you use media to share these stories and spur more conversation? I encourage you to think about how you might bring people together in your community to discuss these questions. Which of these is your next leadership challenge? So now let's see if we can answer some of your questions. Jan?
Great, thanks, Marjorie. We have some questions that are related specifically to the GAP reports. So one has to do with, have we thought about doing GAP reports by race, ethnicity, and the other has to do with, does the report include information on substance abuse trends?
Yeah, thank you very much for those questions. We are definitely interested in further exploring the gaps that exist in other dimensions. So as I said, this report began with looking at differences that exist among counties within states, but we recognize that there is a need for more information to better understand gaps that exist among other population subgroups, and even really to drill down further within counties to understand the differences that exist. So I can say that that is absolutely an interest area for us. And one of the biggest challenges moving forward is finding data sources that allow us to effectively break down some of the point estimates to understand what the differences really look like. And I'm sorry, repeat the second part of the question there.
The substance abuse trends.
Oh, right. So the health gaps reports absolutely talk about excessive drinking as a measure, for example, of inappropriate use of substance. In terms of trends, I would encourage you to look at our key findings report to better understand some of the measures and their outlook over time. The key findings report is also another place to have a good look at other ways that we've broken down data, in this case by region, looking at urban versus rural trends.
Yeah, that's perfect timing too, because that was actually one of the other questions had to do with differences between regions. And I just posted that in the chat link, how to get to the key findings report. So let's see. One of the other big questions that have come in has to do with, are there other data sources available for exploring like other geographic units? What do we know about when it comes to that?
Yeah, that's a great question. And there are many partners and key players in our so-called data to action sandbox out there who've really got a strong interest in refining the snapshot and taking a closer look at data, making data more available. They've taken many steps in this area that we are working with them in coordination on. So for example, at the state level, you can check out America's Health Rankings and Measure of America's Opportunity Index that provides some additional data on disparities at the state level. And there are some other platforms out there that have sliced and diced data in various ways and at different levels, like the Community Commons and PolicyLink's National Equity Atlas. So there's many efforts underway, even at the city level, for example, with the 500 Cities project, that will allow folks to explore gaps that may exist in data at various levels.
Great, thanks Marjorie. And actually, we're going to be posting a handout with the slides, which I actually attached to this webinar, but the slides themselves will be with the recording of this short webinar, not the prioritization handout that we mentioned at the beginning, but a different handout that will be, because that went with another webinar, but chat links for this, and in that there'll be data sources that Marjorie was mentioning. So that's great that you just went through all of those. There's a lot out there. Here's a question. It has to do with how do we pull data directly related to an Indian reservation when the reservation is located in 2 counties?
That's a great question. At this time, we aggregate our data at the county level and not across counties. However, if you live in a community that straddles 2 different counties, you can pull up both counties on our website to look at sort of what their values are for any given measure side by side. That doesn't address the issue of wanting to have a different unit of analysis for a given community, but allows you to see what communities look like that if you happen to straddle a boundary, a county boundary.
Thanks. And speaking of counties also, are there, let's talk a little bit about how they can dig more into their county data, what that's relevant to gaps.
Sure thing. So there are a number of measures, just thinking about from a county snapshot, what we have that already provides a more refined picture of potential gaps that may exist in your community. You can go to your county snapshot and look at measures like income inequality and residential segregation that provide a more refined picture of differences in opportunities to be healthy that exist within your county. Of course, the coaches are a wonderful resource to go to when thinking about how to best really dive in and take action on any of those issues that may come to the surface with measures that present gaps.
Well, I think we have time for just wrapping things up at this point and letting people know about our other webinars and so forth. So I'm going to let you bring us home here. Thanks, Marjorie.
Sorry about that. So we do encourage you to check out our upcoming and archived webinars on our website. You can go to www.countyhealthrankings.org/webinars. And to learn more, you can also sign up for our newsletter. And really, a big thank you to all of you for joining us today for this short webinar. Hopefully you got a very nice, quick, short and dirty on the Health Gaps report and the opportunity to then navigate and find out a bit more. We look forward to your feedback and to seeing you on future webinars.